7 topical OTC medications that are safe and effective for dogs. Hello, welcome back to my channel. If you're new, welcome. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book. So I went to the pharmacy, I walked the aisles, and these are 7 topical medications that I have regularly used, and I am comfortable suggesting you could use these in your dogs. Number 1, this is Visine for dog eye infections. The anti-inflammatory in Visine, tetrahydrozoline, it seems to be reasonably effective for our dogs that have conjunctivitis or red eyes. Just pull your dog's lower eyelid down and you're putting in 1 to 2 drops. You're doing that 3 to 4 times a day for 5 to 7 days. Number 2, this is Polysporin with pain relief or Lidocaine. Polysporin is an okay antibacterial polymyxin gramicidin. But what I like about this version is that it also has lidocaine, a topical painkiller. If your dog has a cut, you want to be able to first clean it well. It'd be a great option to put some of this polysporin on topically. Partly it's going to cover that wound, but secondarily you're going to have that lidocaine be absorbed. Then it's going to make it a lot easier if you get in and thoroughly flush that wound. It's probably a good idea to have something like this in your first aid kit. You'd be applying this 2 times a day, 7 to 10 days. Number 3. This is 1% Hydrocortisone. Pretty much all topical veterinary medications, they have some form of corticosteroid, such as cortisone in them to help decrease inflammation. Your dog has an acute area of red itchy skin. It would be fine to get yourself some of this 1% hydrocortisone. Rub that into the area of the affected skin. You want to be doing that at least twice a day, somewhere between 7 to 14 days. If your dog has an insect bite, they have an area of their skin they just won't stop licking, you could once again consider 1% hydrocortisone. Number 4, this is the hemorrhoid cream, Preparation H. Preparation H is primarily used to decrease inflammation, but especially shrink blood vessels. So one of the ways I often use this in veterinary practice, if we would have dogs that ran too far on the road, for instance, or sometimes even had their feet dragged, imagine having all their pads worn right off. I found like the best topical that helps sped healing was this Preparation H. We would apply it topically and then put on a small bandage. Be doing that at least twice a day. Most of these guys, it took about 2 weeks to heal the wounds. Preparation H, it can also be used on your dog's anus. So say you've got a dog with an anal gland issue and it looks like there's a fair amount of inflammation. Once again, feel free to apply this topically as well. Number 5, this is the OTC antifungal. This is Canesten. The drug name is Clotrimazole. I had many clients, and I myself even used it a ton in veterinary practice. Works really well for our dogs that have ear infections. So typically when our dogs have ear infections, often you're going to see this sort of waxy black debris. Most of those dogs, that is yeast. What is the best antifungal? This guy here, Clotrimazole. Dog with a yeast ear infection, you're going to apply a small amount into the base of your dog's ear. Rub the base of the ear really well. You're going to be doing that twice a day, somewhere between 5 to 10 days. Other areas our dogs can get yeast, it can grow secondarily for a dog that have allergies. So it wasn't uncommon for me to see it within the armpits. Sometimes you see this yellow thickening in the armpits, fairly itchy. In that case, you could apply Canesten topically, twice daily, 7 to 10 days. Sometimes the dogs with allergies, they can get yeast infections in their paws. And what you're often seeing is it's red, inflamed, they just won't stop licking them. And I found many of those dogs responded to Clotrimazole or this topical Canesten. I found this to be a really super helpful OTC antifungal. Number 6, this is Polysporin Ear Drops. Not all dog ear infections though are caused by yeast. Some are caused by bacteria. So because of that, many of the veterinary medications, they combine a bunch of different things to try to cover it all. They'll have some type of antifungal like the Canesten, but also some type of antibacterial. And that's why you could be using this, the Polysporin for ears. A really good treatment option is using this in conjunction with the Canesten. You're treating your dog for an ear infection. Doesn't seem like he's responding as well just to the Canesten. Get yourself the Polysporin for ears. You put in your little squirt of Canesten. You're going to add in, you're going to put in 1 to 2 drops within your dog's ear as well. And you're going to rub both of those, mix those in, rubbing those down into your dog's ear canal. Doing that, twice daily, somewhere between 5 to 10 days. Number 7, this is tissue glue. I used to use surgical glue like this quite a lot in veterinary practice. especially for some of these minor wounds, it was a great option to put this topically onto the skin, bring that skin folds together, and actually stop the bleeding pretty quickly. Then be a super good option to add to your first aid emergency kit. Your dog has cut his pad. Pads are just notorious for bleeding and bleeding. Really difficult to slow the bleeding down. Tissue glue like this is a great option. You're just gonna put in 2 to 4 drops just into that wound itself. Pinch the edges of the pad together. Hold that till it sticks. And maybe then apply some topical pressure. And often I found doing that in practice, a minute or so would go by, the bleeding would stop, and the tissue would hold together. And I've used all those topical OTC medications on dogs. So there they are, my top 7 OTC medications that are safe and effective for your dogs. Thanks so much for watching this edition of Veterinary Secrets. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.